This video is how we treat forehead wrinkles here at Youn Plastic Surgery. So let's start by talking about what is the cause of wrinkles of your forehead. And the cause is contraction of your frontalis muscle. Now the frontalis muscle are paired flat muscles that extend all the way to your eyebrows along your forehead. And it allows us to lift our eyebrows up. Unfortunately, when we lift our eyebrows up, we can create these horizontal wrinkles of our forehead that a lot of people don't like. Now, these wrinkles are something that as we get older, we see more and more just because the more you crease your forehead, the more you see it. I also see it more in people who have very dynamic faces, those people who are always lifting up their eyebrows. You're the type of person that will have more of those forehead wrinkles versus some of those people that you may know who don't move their eyebrows a whole lot, won't see those as much. There's this urban legend that Elvis Presley used to tell Priscilla Presley that she cannot lift up her eyebrows to create those wrinkles, and that's one reason why she ended up having a fairly smooth forehead. Whether that's true or not, I don't know, but that's technically the story. So they're caused by contraction of the frontalis muscles. So it makes sense that you treat it by causing the frontalis muscle not to contract. And you can do this using Botox or another neurotoxin. So injections of Botox will weaken the frontalis muscle. Okay, and so that muscle that lifts up the eyebrows, if you inject Botox into it, will cause that muscle not to create those wrinkles. So we'll weaken the frontalis muscle temporarily. We typically use anywhere from 5 units at a minimum of Botox to 20 units in the forehead. And other neurotoxins we use as well, but these units apply specifically to Botox. Now, Botox and other neurotoxins last anywhere from 3 to 4 months on average. So this is something that you do need to consider retreating 2 to 3 times per year if you're undergoing treatments for your forehead wrinkles. So how does the treatment work? Well, basically, I perform the treatment in my office as well as I have a team of injector specialists that do it 5 days a week. The area, we can numb the area up sometimes with a little bit of ice. Sometimes we use a little bit of numbing spray. There's many options for that, although it's usually very, very well tolerated, and a lot of people don't use any type of numbing at all. We inject the Botox the tiniest amounts in tiny little pokes along the forehead. Okay, and because that muscle is a fairly wide, flat muscle, you do need technically multiple injections to kind of hit all of those areas. Afterwards, if you want to put a little bit of ice over the area, you can, although it's not always necessary. There are risks with the treatment. We'll talk about cosmetically what the risks are, but medically the risks are bruising. It's not uncommon to get a little bit of bruise there. You'll definitely have a little bit of swelling initially, although that usually goes away within a day or two. And it does take anywhere from around a week, even up to 2 weeks for the Botox to really start working. Okay, so it does take time. You don't necessarily leave the office with a smooth forehead. There are risks, like I said, other risks with it. Once again, the bruise. There's swelling that we've talked about, but really those are kind of the main things that you can see. Because the forehead is fairly far from the eyelids, there is very minimal risk of a true eyelid drooping, although that's always, I suppose, possible. Now, the big thing that you want to consider if you're going to consider Botox injections for the wrinkles of your forehead is that it really will change how your eyebrows look, where they sit, and how they move. So let me show you here. If you have arched eyebrows and you undergo Botox injections, they can overarch them potentially. Okay, and it depends on where the Botox is injected. So if you've got eyebrows that are kind of arched like the patient there, and the Botox is injected just in the central forehead in a V shape that we do in some patients, it can cause those eyebrows that are already arched to arch even more. And that can cause you to look fairly strange and even potentially angry. Okay, so if you've got arched brows, you can overarch them with Botox. However, if you have very straight brows, or if your brows are quite droopy, injecting Botox in the forehead, if it's not done the right way, can actually drop those eyebrows too, and they can make your eyelids even feel heavy. So there are people, and you may be one of those, if you look in the mirror and you're always doing this, your eyebrows are always lifting up, if you're a bit older and maybe you've got some extra skin of your eyebrows, and you're always lifting your eyebrows up, if you inject Botox there, it's going to cause those eyebrows not to lift anymore, and it can really drop them, okay? Whether you have straight brows or not. If your eyebrows are really low, it can drop them so much that you can even impinge on your vision. If your eyebrows are really arched, like I showed you here a minute ago, and you injected it improperly, then it can cause the eyebrows to overarch and to look very strange. But all this kind of bad stuff, if it's done appropriately, you can take a brow that is relatively flat and you can give it a nice arch like you see on this picture. The before, the eyebrows are fairly flat, and afterwards you arch them and it looks much nicer. But the key to doing this appropriately is you want to start slow and use a small number of units. Okay, and so if you come in for the first time to YPS and you're thinking that you want to try some Botox into your forehead, most of the time we start with a small number of units, anywhere from usually about 7.5 to 10 units. We inject it kind of centrally, or we can inject it kind of over throughout. All really depends on your individual anatomy. Okay, so if you're looking for a bit of a lift of the brows or the arching of the brows, then we'll inject it kind of centrally in a V shape, V pattern in your forehead. Okay, that also, if you've got kind of a low brow, that can help arch it and may even make your brow feel like it's a little bit lifted. If, however, you've already got a really arched brow as it is, then we're very careful not to do too much centrally, and we kind of may spread it out a bit so that you don't get overarching of the brows. And so the key with Botox and other neurotoxins for forehead horizontal wrinkles is you want to get evaluated by somebody who has a lot of experience in treating it. Because if the person does not, they can really cause your eyebrows to look real funny. This is not the same case for Botox into the glabella, which is the 11 sign, or out in the crow's feet. That you can pretty much do the same way in most people and get a reasonable result. It's just with that forehead that sometimes things can look a bit strange. So just keep that in mind, and I hope that this information has been helpful for you. Don't be afraid of Botox into the forehead. We can definitely improve those forehead wrinkles. It's just we have to use your anatomy and really kind of individualize that procedure for your anatomy so that you get the best results. Thank you for watching. These are your solutions for forehead wrinkles.